All right. So, welcome to today's webinar for busy lawyers. I'm Laura. I'm a law practice advisor for Lawyers Concerned for Lawyers. Today, our topic is key new information on access to health insurance for solo and small firms in Massachusetts. We're grateful to have our partners and guest speakers in this. And I'm going to turn it over to Heidi Alexander for more information.
Great. Thank you so much, Laura. Thanks for having us. So I'm Heidi Alexander. I'm the director of the SJC Standing Committee on Lawyer Wellbeing. And that committee was launched in 2020, and we examine issues impacting lawyer well-being. We collaborate on the implementation of programs and services and initiatives to improve well-being. And of course, we work very closely with Lawyers Concerned for Lawyers in the Law Office Management Assistance Program. I will put our website in the chat if you'd like to learn more about what we are working on. So this particular program topic is focused on access to health insurance, because we see access to health insurance as a well-being issue. In our report of 2019 report to the justices on well-being in the profession in Massachusetts, we know that a large pressure felt among small firms in particular are financial pressures, and that includes accessing affordable health insurance. And so one of our goals is to help alleviate some of those financial pressures. And so we have been working with the Massachusetts Health Connector for Businesses to establish a program that allows small firms to access health insurance and different benefits. And of course, this is particularly important because as our demographic and law practice survey report shows us, there are actually about 2/3 of all the registered and active lawyers are either in solo practice or small firms, which constitute about 20 or fewer lawyers. So there are a lot of you folks, and we are working on lots of different programs and services to provide assistance and support. So I want to introduce our speaker today, who is going to provide you with all the information that you need to know about this new program. And we will put in the chat all the different links. We have them on our website as well, so there'll be many different opportunities to access this information. So I want to introduce Shaitra Sanders from the Massachusetts Health Connector for Business, and she is the expert on this topic and has been working with us very closely to launch this program. So Shaitra, I'm going to hand it over to you to give us all the details and further information about this program. Thank you.
Thanks so much, Heidi. And Heidi, do you mind confirming if you can see my screen? Awesome, great. So my name is Shaitra Sanders, and I'm the Associate Director for the Health Connector for Business. And as Heidi said, I've been working with the committee to make sure that law firms here in Massachusetts know that they have access to affordable quality health coverage. I'll be doing the presentation, and during the presentation, if you do have any questions, please feel free to put in the chat and we will address them at the end of the presentation. If, as I'm speaking, there's no real need to take notes if you don't need to. My colleague Emily will be filling in some helpful links in the chat. So if there's something that I'm talking about in particular, Emily will actually be providing a link to that item, that topic during my presentation. And also, I believe this is being recorded and will be available for viewing later. So let me go ahead and start. So what we're going to be talking about today is what is the Health Connector. We'll talk about some savings, we'll talk about some flexible choices, rebates, and the small business healthcare tax credit, how to go ahead and get started, and also some information for those who might not have employees and who are a sole proprietor or an owner only. So what is the Health Connector? Some of you may be familiar with the Health Connector. We are the Massachusetts State's health insurance marketplace. And what we do is we offer individuals, families, and small employers access to affordable health coverage. So what I'm going to spend the majority of the time talking about is the Health Connector for Business. And that is the platform that we have that allows for small businesses with 1 to 50 full-time equivalent employees the business in Massachusetts to provide health insurance to themselves and their employees. I'm also going to provide some information for those who cannot get health insurance through a business, or might be a owner only or sole proprietor who cannot offer because they do not have any employees. So I'll be able to provide you some information on that. Also, if you've applied in the past as a sole proprietor and not been able to enroll because of, some limits on income, there may be an ability to also have help paying for this, because there's more savings now from the American Rescue Plan and the Inflation Reduction Act. Also, just keep in mind, dental can also be provided through the Health Connector and the Health Connector for Business. I talk mainly about health, but I want you guys to remember that we also offer dental. So just keep in mind, the Health Connector is a marketplace. We are the state's health insurance marketplace. And what that means is that we have all the leading insurers here in Massachusetts in one location. And as you can see here on the screen, these are the leading insurers here in Massachusetts, and you may be familiar with some or all of them. They will be available for you to shop from depending on the location of your business. So let me go into Health Connector for Business. So just a reminder, Health Connector for Business is a platform designed for small businesses in Massachusetts with 1 to 50 full-time equivalent employees to provide health insurance to themselves and their employees. And what we have done since we launched in January 1st of 2018 is get some feedback from employers who come on us and find out why do they like shopping through the Health Connector for Business and enrolling their business and their employees on our platform. And these are some of the great benefits that we have heard back from them. First of all, we're a one-stop shopping solution. We're a completely online platform, and we're the only place in Massachusetts where small groups can actually access all leading carriers here in Massachusetts. Also, we have found that we have competitive premiums. From feedback from small businesses find that they save on average about 20% before any rebates. And this is done through the easy online comparison tool, so they can compare all the leading plans in one spot and choose the one that best suits their budget. We also have some great ways of getting money back. One of them is a wellness rebate, which I'll talk about more in detail in the coming slides, but it's an opportunity for an employer to get back 15% of what they put into their employees' health insurance premium. There's also a great way to create a budget while providing your employees the option to choose the plan that they need, and that's our employee choice models. And I'll talk about that in more detail also. Utilizing the Health Connector for Business is free for you. There's no membership fees, there's no dues, and if you need any assistance from one of our certified brokers who are independent contractors, that service is also free. The only thing that needs to be paid is the premium, and that goes to the carrier. So I just wanted to let you know that utilizing Health Connector for Business does not cost you anything for this service. Also, just keep in mind that all plans that are offered through the Health Connector for Business meet the state's minimum credible coverage, and they receive the Health Connector seal of approval for quality and value. So they are within the state and federal law for the coverage that has to be offered by an employer. Also, there's some great additional items that are available through Health Connector for Business plans. And one of them is a health savings account plan. So if you've also been thinking about or also offer a benefit such as a health savings account benefit, there are plans that are compatible with the health savings account plan, and they're available on the Health Connector for Business. So in that case, you can offer 2 benefits there. We also have access to out-of-state coverage. Carriers that have a PPO plan offer that through our one carrier model, and in 2023, actually the one level model too. And I'll talk about those models in a few minutes. And just a reminder, again, all of the plans on the Health Connector for Business meet the state's minimum credible coverage. When I say that word minimum credible coverage, I'm talking about these 10 essential benefits that must be offered by a plan in order for them to meet the state's coverage requirements. If a plan were missing any of these essential benefits, then it would not be meeting federal and state law and may be subject to a tax penalty at tax time. But all the plans on the Health Connector for Business have these 10 essential benefits and maybe more, depending on the plan. I just wanted to let you know that. If you were shopping off our marketplace, you might want to just make sure all 10 of these are covered. So I had mentioned the employee choice model, and I explained that that was somewhere where an employer was allowed to create a budget and then allowed for their employees to choose the plan that best suits their needs. This is a unique, exclusive way of offering health insurance through the Health Connector for Business. And as I explained a little earlier, this is to allow for an employer to control their costs while providing multiple insurance options to their employees, because not all of us are designed the same. We all kind of need different health insurance options. And so this allows for an employer to truly give their employees the option to enroll in the plan that best suits theirs and their family's needs. And since this is an online platform, it's very easy to compare options and choose the plan that best fits their needs, whether it's looking up summary of benefits and coverage, whether it's finding the doctor in the network, comparing how much it costs out of pocket from their payroll. These are all easily accessible through the online platform. So the employee choice models, they're called one plan, one carrier, one level. So I could go into detail on this page, but what I'm going to do is I'm actually going to move to the next page, and I'm going to compare health insurance to pizza, just to make this a little bit more fun. So one plan, how does one plan work? So imagine you, the decision maker, decide to share the cost of a pizza with your employees. You tell your employees you will get the pizza, but the business is going to share the cost of it. So in the case of one plan, what you say to your employees, you're going to get a pepperoni pizza from the pizzeria down the block. And if you want that pepperoni pizza, we're okay with paying for half of it. It's a $10 pepperoni pizza, and you'll pay for the other half. So if any of your employees want this pepperoni pizza, they now have to get the pepperoni pizza from the pizzeria down the block. In this case, you'll pay for half, they'll pay for half. So you'll take the $5 out of their payroll, but they get the pizza in the end. So that's how one plan works. One plan means that you, the decision maker, choose what carrier you're going to offer your employees, the plan from that carrier. You choose what percentage you're going to pay into that plan, and then your employees enroll in that plan or they don't. Now, I just want to let you know this is not an exclusive option through the Health Connector for Business. This is offered other places, such as other intermediaries, and if you were to go directly to one of the insurance carriers. But this is one of the traditional ways of offering health insurance in Massachusetts, so we do want to make sure that we have this available for employers to buy. So in this case, the employees don't have a choice. They just kind of have a choice whether they're going to enroll in it or not. The decision maker makes the decision here. But pulling into the idea of giving your employees choice, let's look at pizza again. So imagine you say to your employees again, hey, you're going to get a pizza if you want it or need it. Let's say if you need it, actually. So if you need a pizza, we're going to let you get a pizza from the pizzeria down the block. So now you've chosen which pizzeria it's coming from. You look at the menu as a decision maker, you say, the business can afford to pay into half of the pepperoni pizza. So you tell your employees, we're willing to pay into half of the $10 pepperoni pizza, so we're going to give you $5 towards your pizza. Now the employees can go to that pizzeria down the block, look at what's available, and utilize your contribution, which in this case was $5, and buy the pizza they want. So there might be employees who just want a cheese pizza. They would get that, maybe it's $8, but you already decided you could afford to pay into the pepperoni pizza. So in that case, they'll get $3 deducted from their payroll for that cheese pizza they want. Maybe they do get the pepperoni pizza and they'll pay the other half. Or maybe they want a Supreme. Maybe that Supreme's like $15. So in this case, they'll take the $5 you gave them towards the pepperoni pizza the business could afford to pay into, and they'll pay the other $10. So all that they had to do was get a pizzeria from the pizzeria. All they had to do was get a pizza from the pizzeria that you chose, and that utilize the contribution that you put into it. And that's how one carrier works. So what it says here is that you choose what carrier you're going to offer all your employees. You then look at the plans available from that carrier, make the decision which one the business can afford to pay a contribution into. And then those employees can buy the benefit plan that best suits their needs. So, maybe someone needs a little bit more coverage during the year. They might buy a platinum plan because it's more money out of their payroll, but less money at copays for time of service. Or maybe they don't need as much coverage and they're okay maybe having like a little bit of a higher deductible, and maybe they buy a silver. But what they do is they decide what kind of benefit plan they need, and they utilize the contribution that you put towards it to buy a plan from that carrier. And that's one carrier. So the last one is one level. So how does one level work? So you're still going to share the cost of a pizza with your employees. The employees are going to get the pizza, but you're going to kind of make a decision on what type of pizza they get. So you tell your employees, you can get a pepperoni pizza from any pizzeria in our area. We've looked at the menus and we're willing to pay into the $10 pepperoni pizza from the pizzeria down the block. So that's the one that the business could afford. Your employees might not want a pepperoni pizza from that pizzeria. Maybe they'll choose another one, maybe on the other corner, or maybe 3 or 4 blocks down. And those pepperoni pizzas are all going to be differently priced, but what they are going to do is utilize, in this case, the $5 that you put towards the pepperoni pizza from the pizzeria down the block, and then they'll pay the difference outside of their pocket for where they buy that pepperoni pizza from. And so when you think of that for one level in health insurance, what you're doing is you're providing the employees with the benefit tier that you are going to offer all of them. So in this case, I have gold highlighted. Those are usually around either a $0 or $1,000 deductible, the gold tier. So say you offer everyone gold plans, and then you choose a plan from one of the carriers that the business can afford, and then the employees can buy across carriers at that benefit tier and choose the carrier's plan that has their doctor in the network. So therefore, different doctors' needs, different networks, they can choose the carrier that has their doctors in the network. And then if one employee has a different doctor than another employee, they don't all have to change doctors to fit into the one network plan. And that's how one level works. So those are the employee choice models. And again, remember, that's focused on an employer being able to create a budget and allow their employees to choose the plan that best suits their needs. Now, there are options for you as a business to get actually get money back for offering health insurance to your employees. And one of them is our Connect Well program. It's a wellness rebate program. And what it is exclusive to the Health Connector for Business. And businesses that qualify for Connect Well, 1, have to be enrolled on the Health Connector for Business, and 2, have 25 or fewer enrolled employees on the Health Connector for Business. Then, during the year, employees can choose from more than 30 pre-approved qualifying wellness activities. And an employer will receive back a check for up to 15% of what they contributed into all their employees' health insurance premiums if 33% of those enrolled employees successfully participate and are approved for one of the wellness activities. What we found was in 2021, the average Connect Well rebate was about $3,674.79. Again, the rebate depends upon how many employees are enrolled, how much the premium is, and how much the employer contributes into it. So these numbers can range greatly. Employees are also incentivized. They will receive a $100 Visa gift card once their activity is submitted and approved. And just to let you know, these activities are very easy to complete. There's over 30 pre-approved activities. Here is a sampling of some of them. They're focused on mind, body, and money. So mental, physical, and financial health, wellness. As you can see, there's like massage, there's Go for Your Well visit, which is actually a zero cost sharing service actually when you have health insurance. So it would cost the employee nothing to go for their well visit, and they'd receive a $100 Visa gift card, which is kind of nice. Some student loan planning classes, financial literacy courses, and these are just a sample. There is over 30 pre-approved, and they only have to complete one of these during the year and get approved for it. Now, we talk about this, and then I know everyone gets pretty busy during the year. So I just want to let you know that we at the Health Connector for Business help you achieve this Connect Well rebate. So if your business is qualified to participate in this, we auto enroll you. You don't have to ask us. So 10 days after your plan starts, if you have 25 or fewer employees enrolled and you have not received this 3 times already, you'll be auto enrolled. Then yourself and your employees will be emailed to let you know about the Connect Well program. The employees, once they complete activities, they submit it online. Again, online. We try to make it as easy as possible. Then once they're approved, they'll receive a $100 Visa gift card in their email. And once you've reached 33% participation, we email you, let you know that at the end of the year, you'll be receiving some documents to fill out so that you can receive your rebate back, which will be a check for the amount that you get back for up to 15% of what you put into your employees' health insurance premiums. And just to prove that this is real, prior to going remote, in 2019, we did this whole across Massachusetts, and we actually delivered these big giant paper checks. And this owner of Clean Properties, Marcy Berger, she had the best line ever. And she said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So, I'm not sure what she used her $4,000 for, but, she was very happy to get back this rebate for offering health insurance and promoting wellness in her business. So there is another option to receive money back through the Health Connector for Business, and that's the Small Business Healthcare Tax Credit. I want to let you know that the expert at finding out if you are eligible for this tax credit is a tax professional. So the person who prepares your taxes would be the person to let you know if you are eligible for this tax credit for up to 50%. But what I want to clearly point out is that one of the requirements to even be considering to see if you're eligible for this small business healthcare tax credit is to be enrolled through a state's marketplace, small business marketplace. So we are the state's small business marketplace. So that is the reason that you should open this conversation up with your tax professional if you enroll your business through the Health Connector for Business. And then there are some other items that need to be hit, such as average wages, a certain amount of employees, but all of that will be looked at by your tax professional, because we here at the Health Connector for Business do not look at wages at all. So now you've heard about some great exclusive options, some great benefits, the utilization that is all online, it's easy to compare, there's great tools, there's free help. How do you go ahead and get started? Well, as Heidi explained, we have this great partnership with the Lawyers Wellbeing Committee, and you have a dedicated page that is here. And also we're putting it in the chat that you can come to and get assistance. You can review what's available to you. You can start an application. You can compare plans. You can get a quote. You can seek out help from a broker. The key thing is to hit deadlines. So I just want to let you know that as a small business, you can enroll in a healthcare plan on the first of any month. There is no close or open enrollment period for small businesses with 1 to 50 full-time employees. Once you come to the website, if you'd like, for instance, if someone wanted to start health insurance on February 1st for their business, they would have to hit some deadlines in January. So they'd have to actually offer their employees the plan by January 10th. The employees would have to log into their account and enroll in the plan by the 20th. And then the first payment has to be made online by the 23rd. And then seamlessly, the health insurance starts on the February 1st. And then guess what? On February 1st the next year, on the anniversary date, it renews. So it's very seamless process, all online, no paperwork involved. And as I stated, I said it a few times that, there is someone to assist you. You can always call our customer service line, which I'll be providing at the end, but there are some assisters in the community, and they are independent brokers who we certify to utilize the Health Connector for Business, and they are free for you to utilize. One of them might be someone you know, might be in your neighborhood, might be a friend of yours, but we have over 470. I think we're right nearing the 500 mark, maybe in the next day or two. So I'll be happy to say we have over 500 certified brokers soon. They're free for you to utilize. They can easily put together cost estimates. They have this great tool where they can pull together a whole bunch for you and compare plans, compare out-of-pocket costs, because guess what? This is their expertise matter. They have studied this. They have been licensed to do this. They understand what you need based on what they've interviewed you for. The other thing is you're probably focused very much on your area of expertise, which in this case is law. And so they can save you time by doing all of this health insurance work for you. So just really quickly, what I just described in all of those slides previous are for businesses that have at least one non-owner employee enrolling. For those of you who are an owner-only, family-run, partnerships, sole proprietor, someone who is only has ownership, this is what is available for you on our other platform, which is the Health Connector platform. So right now is a great time to be thinking about this if you are a sole proprietor or owner only and you need health insurance, because right now our individual platform is in an open enrollment period. So small businesses don't have any open or closed enrollment period, but individuals who do not get access through a business do have an open enrollment period. And that is happening right now. It started on November 1st and it ends on January 23rd. So during this open enrollment period is very similar to the Health Connector for Business, but it is designed to focus on individuals and what they have access to, and this, see if they can enroll in health or dental based on where they live. Also very similar deadlines. So I think you heard me say the 10th, 20th, 23rd pay. So on the individual side, 23rd is the end. So if you are looking for health insurance for January 1st and you cannot apply as a business because you're a sole proprietor or owner only, you can apply as an individual and see if you're eligible and make your payment by December 23rd, and you'll have January 1st enrollment. So applying through the individual side, you need a little bit more items. So on the business side, the business needs to be in Massachusetts, but if you're applying as an individual, you need to be in Massachusetts, you as a resident, and also be a US citizen and not have health insurance elsewhere. And there are a few more items that you would need to go through, but there is like a checklist, and it will be available in the application. It will tell you what you need, social security numbers. On the individual side, they do look at income. But if you have tried this in the past and maybe you haven't been approved for even some help, some advanced premium tax credits or anything like that, don't let that stop you, because there is a chance that you might be able to get some assistance with paying for health insurance through the Reduction Act. And so through the individual side, there's different ways of getting help. There's the advanced premium tax credit. This could help lower the premium amount you pay each month. And you can go in and do an estimate. As you can see at the bottom, there is a link there to get an estimate to see what you're eligible for. There's also our Connected Care program. These are even lower premiums because they combine advanced premium tax credit and state funds to really help reduce the premium amount each month. And when you're thinking about this, keep this one also in mind if you know anyone too who doesn't have access to health coverage, not just for yourself, but maybe they don't have an employer who offers health insurance, or maybe they're part-time workers or not working at the moment. They can also utilize this open enrollment timeframe to enroll in health insurance. And again, if you're interested to see if you can get any assistance or how much the premiums would be for you, please utilize our estimate tool and see what's available for you from all the plans on the Health Connector. So now I will definitely open it up for questions, unless I know, Mala, you joined a little later than usual. I know you usually give a nice little backup on the Health Connector and our partnership. So if you'd like to do that part now, that'd be great.
Sure. I just wanted to let everyone know that I'm available if you would like just to talk about anything related to the Health Connector relationship or health insurance in Massachusetts. And just to say, I know that having spoken to a lot of people in the state, a lot of lawyers, the concern has been the cost. And there is certainly no way we can get around the cost of insurance, but the connector relationship and the benefits offered by the connector is the best way to get the rebates and a reduced cost of any health insurance relationship I've seen. You know, personally in our firm, we've had the same policy and we've grandfathered into an old policy and we've had it now for 25 years. And the connector relationship offers me the same benefits at a 20% reduction in premiums. And that doesn't even include the rebates that we would get. So I really hope that people will look into this. If you need health insurance, but also please feel free to reach out to me if you need anything, and I'll put my contact information in the chat. But thank you, Shayatra.
Laura, would you like to go through the questions?
I would be happy to. So first of all, Heidi and Mala, thank you so much for your work in bringing Shaitra to us. You do a lot with the Standing Committee on Wellbeing. Shaitra, that was an excellent presentation. You really illustrated the concepts well. I loved too how you went over the pizzas for comparing the one carrier and the one level. Emily, you've done great with putting in information in the chat. So I thank you all for that. We've had several questions come in. One noted that they had tried to complete the online form, but it required an EIN. For people who don't know, EIN is Employer Identification Number. You can apply for free for those through the IRS website. And as a solo, this person notes they did not have one. The Social Security number did not work to continue with the form. Do you happen to have thoughts for that, Chaitra? Would they need to apply for an EIN or as a solo, should their Social Security number work?
So in this case, as a solo, I would advise them to go to Health Connector for individuals and families, and they can apply that way with their Social Security number. And then once they have an employee who also, you know, if they go to that route where they have to employ someone and they need health insurance for both themselves and their employee, then they should then transition over to the Health Connector for business side. And by then they should have a tax ID number if they're employing other employees.
That is great. Thank you so much. So Health Connector for individuals and families. This next question plays into that as well. This person asks about, as far as the ability to make itemized deductions of premiums at tax time, are there differences between enrolling the family via the sole proprietorship and enrolling the usual way? Would you suggest they also go to Health Connectors for individuals and families?
So any deductions like that, I would definitely refer to the tax professional. I'm not an expert on that, but if they do not have any employees who are enrolling, then to go ahead and apply as an individual. But if this is something where they wanted to enroll themselves and offer this to their employees with employees who need health insurance, then they should definitely come to the Health Connector for business, and their tax professional will help them with the deductions.
That's great. And also great note too that on tax advice to certainly seek out tax professionals for their input. This questioner wonders, is there time to sign up before open enrollment ends at the end of 2022?
So I'm not sure which platform they're referring to. So if it's as a sole proprietor or an owner only, open enrollment on the individual and family side goes until January 23rd. So yes, you have until next month, the 23rd, for an open enrollment period. Or if anytime during the year something changes in your life, such as maybe lose health insurance somewhere else, get married, have a child, those are qualifying life events that you can complete an application outside the open enrollment period on the individual and family side. For the Health Connector for business side, you can enroll your employer, like actual company, any first of the month. So there is no open or close enrollment period. You can start your business on the first of any month.
Fantastic. That is so informative. Thank you. Our next questioner asks, for a solo practitioner, would the lawyer receive both the incentive and the 15% rebate, or is that only for employees of that lawyer?
So if enrolled through the Health Connector for business, that is where the Connect Well and the small business healthcare tax credit comes into play. So if you have employees and you're self-enrolled on the Health Connector for Business, and you participate in the Connect Well, then you're part of that. You're also an employee. But if you are enrolling as just yourself, no employees enrolling on the individual side, Connect Well and the small business healthcare tax credit are not part of those benefits. There are other items on the individual side, such as those advanced premium tax credits that might be helpful, and also the Connector Care program, which please, of course, I highly advise you to utilize that estimate tool and see if you're eligible for any of those if you are a sole proprietor.
Chaitra, you are so well informed on this. This is very, very helpful. This is a follow-up question to that. Do any of the incentives mentioned in the first section apply to owner only? And they're specifically asking about the tax credit. Does that play into what you were just saying, or is that a different part?
Yeah, that plays into what I was just saying. They would have to be on a state small business health insurance marketplace. So that they would have to be enrolled via the Health Connector for Business, which they wouldn't be able to do unless they at least have one employee enrolled with them at initial enrollment.
Okay, great. Our next questioner asks, may a Massachusetts small business offer coverage to an out-of-state employee through the connector?
They can. Actually, one of the reasons that we make sure carriers offer PPOs is because we are well aware that employers have the ability to hire outside of the state. So all the carriers that have access to a PPO will have that option for employees to enroll in through either the one carrier or the one level model in 2023. It used to just be the one carrier model, but we also added on the one level. So the employer can pay into any of the plans, but the employees will have access to the PPO, and those are designed there for out-of-state employees.
Okay, great. We have two questions about sole proprietors and whether they can go through the Health Connector for Business portal. This one is wondering if sole proprietors can enroll as a business as an option. This next person notes, if you create an LLC or PC with one attorney, can you go through the Health Connector Business portal? Or is that something that they would go through the Health Connector for individuals?
So the key for the Health Connector for Business is at initial enrollment to have at least one non-owner enroll with you. And I do say the key initial enrollment to enroll with you. If you do not have a non-owner enrolling with you, then you would go on the Health Connector for individuals and families.
Okay, great. That helps clarify. This person wonders, they had an individual non-subsidized plan through the Health Connector, Tufts for years. They've come across some doctors who do not accept the connector because it is Massachusetts Health. Do you know if doctors can choose not to accept connector plans? And this may be specific office by office, but do you happen to know about this?
So I'm gonna tell you that a doctor, does a contract with the carrier. So it is based on if the doctor is in that carrier's network for the plan. So the key would be to look up the provider search tool, which is available on our website. Also ask the doctor's office, and they can also confirm with the carrier to see if that doctor is taking their plan.
Chaitra, can I just jump in here, because I've had this question come up before. Just because you're a member of the connector or you get your health insurance through the connector, a doctor's office or a provider won't know that you're purchasing your insurance through the connector. All they know is that you have Blue Cross or Tufts or Harvard Pilgrim, right? So there's no penalty to you through providers because you get your insurance through the connector.
No, they would need to just check to make sure they're within the carrier's network for that plan.
Right.
Yep. And again, we have a provider search tool is aggregated on our platform. Also the carriers, they have search tools on their website. So once you're a member of a health insurance plan, you can usually go to the carrier's website. They usually allow you to log in and you can search. I think I think most of them even let you like download your ID card if you need to online. And that tool is available at the carrier site too. And also their customer service should also be able to assist the subscriber with letting them know if the doctor takes or doesn't take that carrier's plan.
Great, very helpful. Our next questioner wonders, will participants of the webinar get recordings of the webinar with slides and information? I can answer that, yes. If you signed up in advance, you will be sent a recording with the slides probably tomorrow. We'll just have to upload it. And this webinar will also be available afterwards on our website at masslomap.org, which is part of Lawyers Concerned for Lawyers, under the Webinars for Busy Lawyers on Demand section. Our next question, will the brokers listed also be able to answer questions from solo practitioners?
They definitely know about health insurance, so you can definitely utilize them for any health or dental insurance needs. They will be able to assist you. That's their area of expertise. So they will advise you either way that makes sense for you and your business to go.
Okay, great. Our next two questions ask about family members. So the first one is, can the second person being enrolled be a spouse or other dependent?
Could you repeat that question? I think I heard it correctly, but I just wanted to hear it one more time.
Sure. And I'm not sure if this is applying for Health Connector for families or for business, because it's saying, can the second person being enrolled be a spouse or other dependent?
Okay, I think I did hear it the correct way. So if you're enrolling on the Health Connector for business, a spouse and a dependent are still considered owner. So you would need someone not the actual full family member, right? Within that same like family to be the non-owner. That's what I think is being asked for the Health Connector for business. So if it's like family run, that would be like still considered owner only. So spouse, dependents. It would have to be someone who really does not have any ownership in the business.
Okay. And our next question is, could a sole proprietor put a family member on payroll, then take advantage of the better benefits of Health Connector for business instead of going through Health Connector for individuals?
So again, it would have to be a person who has no ownership in, I mean, I don't know if they hire their niece or something, they have no ownership. That's a non-owner, but not in the immediate household, right? So not the spouse or the dependents.
Okay, very good. Heidi is also being very helpful in helping answer questions in the chat, just as Emily was great and putting things in the chat earlier. So the PowerPoint will be included in the information you receive, yes. And in addition to being on the Lawyers Concerned for Lawyers website, it will also be available on lawyerwellbeingmass.org/health insurance. I encourage you to check out the Lawyer Wellbeing Mass site. They have excellent resources and have dedicated a page to this. And yes, LCL will send out a recording tomorrow on this. It looks like we have gone through all of the questions that have come through in Q&A. Chaitra, I know that you have done this presentation multiple times in the past, and as I said, we're so grateful for having you with us today. Are there questions that regularly come up that haven't been addressed yet?
Not from my knowledge. I think I kind of said things during the presentation of questions that I usually get. Heidi and Mala, are there any items that you noticed that were not brought up or covered during the presentation?
No, not from my perspective.
Yeah, I mean, I would just highly advise if any businesses want to really look and see what they might be eligible for, please utilize the website that's here on the page, call our customer service line, reach out to one of those local brokers. There's a whole search tool on our website. You know, if you reach out to any of us, Mala, Heidi, you know, Laura, anything like that, we'll definitely assist you in any way possible with the the right place to go.
Very good.
Right? We're the
Thank
right place for the right plan.
Heidi, did you have parts that you wanted to add on things when you've heard this presentation in the past of things that you really think people should have as highlights?
No, I do not have anything to add. I think everyone did a great job.
Okay, wonderful. Yes, I completely agree with that. Everyone did a fantastic job. I will note, since we have gone through the questions, yes, this will be available on the recording and on the websites. Our next webinar for busy lawyers will be January 18th, 2023. We're going to have attorney Miriam Kowalski talking about the benefits of mediation strategies to better serve your clients. And again, I want to thank all of our guests and experts today. This has been absolutely tremendous. Chaitra, would you like to close with any final remarks?
Just thank you for having, me present today, and Mala and Heidi, really loving this partnership, and really happy with seeing where it's going and helping all of these law firms. And hopefully we can help some individuals who were on this call today.
Yes, agreed. Well, thank you attendees for your time. Thank you, Chaitra, Emily, Heidi, and Mala. We appreciate it so much, and we wish you a good rest of December. Take care.